Hello everyone, welcome at SudhirEyeCoach, a channel for emerging and budding ophthalmologists. The purpose of making these videos is just to offer insights and practical thoughts, processes to help you learn cataract surgery, especially as you begin your journey into the cataract world. In today's videos, I am sharing a case of an intumescent cataract. As you know, intumescent cataract often presents with a raised intralenticular pressure. My usual approach is to first create a small baby capsular Rhexis to safely decompress the lens. Once the pressure is relieved, I then extend the Rhexis to a moderate size for the safe phaco fragmentation. However, in this particular case, you'll see the pressure was significantly high, although I successfully initiated a capsular Rhexis, created a baby Rhexis, but during decompression, the Rhexis extended towards the mid-periphery. Fortunately, the anterior pressure antechamber was already filled with high viscosity viscoelastics. So then I reinforced this again to stabilize the chamber. My idea was to make the anterior capsule flat. This is crucial. Any anterior chamber movement of the nucleus, anterior movement of the nucleus in such cases can further extend the Rhexis and can lead to complications. After taking a moment to stabilize the situation, I proceeded to complete a modern size capsular Rhexis using Utrata forceps. Thankfully, the nucleus was soft, typical in such cases, white cataracts. So phacoemulsification or fragmentation was not challenging. The patient had a posterior capsular plaques, which we managed later with a YAG laser capsulotomy. I implanted a single piece hydrophobic implant to complete the case. Watch the video to see how I manage this case step by step. If you have any thoughts, questions or suggestions, I would love to hear from you in the comments. And if you have not subscribed the SudhirEyeCoach channel, my request is please do so. Your support helps us to bring more educational contents in future, and this is my way of sharing my experience to others. So enjoy. Thanks for watching and enjoy the video. Thank you.